Good afternoon, everyone. My name is Kerry Jones-Kenser. I work at Sheffield Carer Centre, and I'm here with my colleague Jill, who is on our stand. She is our health liaison officer, and so her overall work is to work with you and your other health and social care colleagues. Can you go to the next one, please? Thank you. So we always put this in because we think it's worthwhile just stressing who is a carer. At Sheffield Carer Centre, we work with all adult carers, and we work closely with our colleagues who are Sheffield Young Carers, and we overlap. So we work from the age of 18 and they work up to the age of 25. So a carer is someone of any age who looks after a person, usually a family member or a loved one, but I have been told that it's definitely not, it's my mother-in-law, but it's usually someone that they do out of love, and they support them and they need that help because of illness, frailty, disability, mental health, etc. And the key distinction is that they are unpaid. Next slide, please. So these are just some stats that we have. There's approximately, from the last census, there's about 60,000 carers in Sheffield, but because it takes up to 2 years for someone to recognise themselves as a carer, there's usually a lot more than that. It's not a static, so there's people moving in and out of being a carer all the time, and it's generally accepted that there's about 20,000 people who stop being a carer every year, but then there's also 20,000 people who start being a carer every year, and which is why it's so important that we are continually raising awareness so that people are able to recognise that they are a carer. Being a carer saves the economy about the equivalent of another NHS every year, and so it's a huge cost saving, and it's reckoned to be just under 20,000 per person per year. We know that carers tend to have worse health outcomes than people that aren't carers, and because they are so busy caring for their cared for person and don't consider themselves, and they also have worse financial outcomes than the general population, and that's because overall they tend to either have to stop work at some point or have to work fewer hours and therefore have less income coming in. Next slide, please. Okay, so at Sheffield Carer Centre we have two different services. One is called the Universal Service, and the Universal Service tends to be enough for most carers, and so people come to us and they can get referred by health and social care professionals, and there's more information on our stand about that, and Jill will be able to talk to you. But once someone has come to us, they would get registered with our community of carers. They will get sent a welcome pack, and they will get sent a carer card. The carer card gives them some forms of discount to things in the city, but the key thing is that on the reverse is the emergency contact details, which means that they're able to tell people if something happens to them that they're a carer, and therefore their carer can continue to be cared for. Next slide, please. So we provide a lot of information, advice and guidance. We have monthly newsletters. There are a whole host of different activities that people can get involved with, and we have Carer Connect, which is a befriending service, as a legal clinic, and we have an involvement network where people can help shape not only what we do but also the work of others in the city. carers ask us to set up different activities. And so, for example, the men's group and the menopause group are both new groups that we've taken on. The men's group has 405 people in it and 382, and it's actually the same number as the menopause group have in the menopause group, but 382 of the men have said that they want to have counselling. And so we are working with Sheffield College so that we can work with some of the students there that are at level 4 so that they can support the men's group. The menopause group is also new, and there's 382 people in that. We have 19 groups that have about 20 or so people in there. So if someone asks us and they're a carer to do something, we will try to accommodate that. So we also have what is called the carers service, and the carers service is about assessment and support. We have the statutory obligation from the council to undertake carer assessments, and every carer has the right to have a carer assessment. Carers can contact us via our advice line, and we do a lot of casework and advocacy on behalf of our carers, and we also have respite grants and hardship grants that are from ourselves and also from the Carers Trust. We currently have just under 200 carers who have carer support plans, and with that comes a personal budget, and that enables the carer to have additional support. Usually there's a lot of cleaning, laundry, gardening, but then there's also therapies that people can get involved with. They can have massage, things like that, and that is determined on what are the needs of the carer. Next slide, please. So we work with all carers in the city, not just ones that are caring for people with dementia, but on our books about 30% of the carers have cared for people who have dementia. So it's a really high proportion of our carers, which is why we are involved so much with dementia. So we do workshops on the Herbert Protocol, and we do a lot of awareness raising for staff. There's been a huge amount of work that has been done by Jill with colleagues from STH, going into on wards, going into the cafes at the hospital to talk to people, raise awareness, and also show the different resources that we have for health and social care professionals. Next slide, please. So what we are hoping for is we are doing consultation with the carers of people with dementia. There's a carer section on the STH intranet, doing more workshops so to support our carers who are caring for people with dementia, and so that we can increase the referrals to the carer centre. Because it takes up to 2 years for people to recognise that they're a carer, that therefore means that there's those 2 years where people have not been accessing support. And what we want to do is for people to be able to access us earlier, so that there are less carers who are coming to us in crisis. Because by the time people have recognised that they're a carer, and then they get the courage to talk to us or to go through a support group door, then a lot of the time they are getting to being in crisis, if not there in fact. Next one, please. So we have a lot of leaflets and posters that are around carers being able to see what we do. We have these information cards which enable people to just put them in their wallet, and so it's there for people to be able to access with our phone number. Next slide, please. But we also have, and there's a whole host of these, different toolkits for professionals that are available on our website and can just be downloaded. Also, Jill does go around and talk to people, as do I, and so if people want us to come and talk in your areas, then we will be really happy to come and do that. And I think that is it. If you want to do the next, yeah. So please do just get in touch, talk to Jill, look at our website, call us, and we will do whatever we can to support you, to support the carers that you care for. Thank you.